Cardiovascular autonomic neuropathy. One of all serious complications of diabetes is cardiovascular autonomic neuropathy, which encompasses damage to the autonomic nerve fibers that innervate the heart and blood vessels, resulting in abnormalities in heart rate control and vascular dynamics. Autonomic dysfunction can affect daily activities of individuals with diabetes and may invoke potentially life-threatening outcomes. Advances in technology now make it possible to objectively identify early stages of cardiovascular autonomic neuropathy with the use measurement of autonomic function that are based on symptom control. The LifePulse Pro diagnostic system allows us to determine the manifestations of signs of autonomic neuropathy in a simple and accessible way. To do this, 3 functional tests are carried out. Breath test 6 breaths per minute. The Valsalva test. Orthostatic test 30/15. The breath test module evaluates the response of the cardiovascular system to controlled deep breathing. The results of recording pulse waves are shown here. We see a wave-like graph of changes in cardio intervals under the influence of 6 deep breaths. The Valsalva pulse test is used to evaluate the function of the autonomic nervous system. During the Valsalva pulse test, the patient is asked to take a deep breath, hold it, and then forcibly exhale while closing the mouth and nose within 15 seconds. Normally, during the strain phase of the Valsalva test, there is an initial increase in heart rate, followed by a decrease in heart rate during the release phase. If the heart rate does not decrease appropriately during the release phase, this may indicate autonomic dysfunction that affect the cardiovascular system. Valsalva test results are shown here. We see small changes in cardio intervals in the phase of tension and release. The 30/15 orthostatic test evaluates the response of the cardiovascular system to changes in body position. The algorithm measures the ratio of cardio intervals of the 30th and 15th heartbeats in the process of getting up into a vertical position from a lying position. The results of a 3-minute recording of pulse waves during an orthostatic test are shown here. The 30th and 15th cardio intervals are highlighted in red. The General Cardiac Autonomous Neuropathy Symptom Detection module shows the results of 3 tests at the same time. This example shows possible early signs of cardiac autonomic neuropathy. Attention should be paid and appropriate action taken. To obtain more complete information about the patient's condition, using LifePulse Pro, we can analyze the results according to the HRV test methods additionally.